Hello everyone, and welcome to another episode of Nurse Reviews Cells at Work Code Black. Today we're going to be looking at episode number 12, which is called Return the Heart and Demise. So last episode we left off with some imagery of a blood clot and some just really disgusting and gross looking blood vessels. So between that and the fact that this episode title mentions the heart, I'm going to be guessing we're going to be looking at coronary artery disease. Now, I will be honest with you, I'm actually really excited for this episode because if you don't know, my specialty is involving critical care and cardiology. So coronary artery disease is just something I deal with on a regular basis. So I'm really excited to be exploring this in Cells at Work Code Black because it's finally something that I specialize in. So yeah, without further ado, grab your drink of choice. Tonight is just herbal tea because it's nighttime and I gotta be up in the morning. But yeah, without further ado, let's dive right in.
3戦弁が開きます。赤血球は立ち止まらず、速やかにお進みください。
ようやく全身を一周して戻ってきたっていうのに。
タイムカードなんて押したって無駄だよな。
So here we find ourselves back in the heart. So this was covered a little bit in the first season of the main Cells at Work series, but here I guess we're going to go more into what happens when you have an unhealthy heart. The fact that they're waiting for the tricuspid valve to open tells me that they are currently sitting in the right atrium. So the right atrium is the first of 4 chambers of the heart that the red blood cells enter in order to go back into the circulation. So your heart is divided into 4 separate chambers: the right atrium, the right ventricle, then the left atrium, and then the left ventricle. And from the left ventricle, it gets pumped out into the circulatory system. The tricuspid valve is the valve that separates the right atrium and the right ventricle. So when your right ventricle empties out, the right atrium will pump the blood through the tricuspid valve into the right ventricle to fill that chamber as well.
上の連中だってろくに見ないくせにや。
まったくだ。俺たちには有給も代給もないしな。俺たちに休みがあるとしたら、この場所。心臓が止まるときくらいだ。
So he is right. The blood really doesn't stop until it actually gets to the heart. So the heart has 2 phases, systole and diastole. Systole is the active part of the cardiac cycle. So that is when the muscle of the heart is squeezing to pump out the blood into wherever it's headed. Diastole is the opposite. It is the resting phase of the cardiac cycle. So that is when the heart muscles relax and it allows the chambers of the heart to fill up with blood again. So truly at the end of your diastolic period is when your blood is going to be the most still because it has now filled that chamber of the heart and is just waiting for the systole part of the cardiac cycle to start, where the blood will just start moving again.
あんたも散々見てきただろ。コレステロールの塊、プラークをさ。
プラーク。コレステロールや脂質が蓄積してできるコブのような塊。口の中のプラーク、思考とは異なる。
そいつらが血管の至るとこで崩落してんだ。それを修復すんのが俺らの仕事なんだよ。
だとしても、こんなに一度にあちこち工事されたらたまったもんじゃねえ。もっと効率よくやれよ。
じゃあ全部ほっとけってのか？あ？
So the disease that we are seeing here is called atherosclerosis, which is when you have a buildup of plaque on the inside of your blood vessels. So this plaque, as we saw here, is a result of an excess of cholesterol and fats and things like that. And this was actually touched a little bit on the first episode of the Code Black series, where you saw like the little LDL gremlins dumping cholesterol into the blood vessels. And I did talk about it in the first episode if you haven't seen it. Anyway, so what happens is that these fatty deposits end up going on the inside, are building up on the inside of your blood vessels. And this irritates the blood vessels and causes an inflammatory process, which obviously brings out your white blood cells. namely, in this case, your monocytes and your macrophages. So these white blood cells will stick onto this fatty deposit in order to try to fix the problem and get rid of it. But unfortunately, they end up causing it to like harden and cause all sorts of chemical processes that, long story short, end up forming what they call like a fibrous cap on top of that fatty deposit. So I think what they're alluding to here is the platelets are attracted to these damaged blood vessels from all this inflammation and plaque buildup and whatnot. And studies have shown that platelets, as great as they are, they can cause problems as well. So it's shown that they can mediate some of those inflammatory responses that makes this plaque buildup even worse. As you can imagine, as you start to build up this plaque in your blood vessels, it does start to block the flow of the blood through that route. And what can also happen as well is when you have plaque buildup, some of that can eventually break off and travel downstream to a smaller blood vessel and end up blocking that as well. These plaques that form on the inside of these vessels and these sort of clots that break off and float around and cause all sorts of blockages, these are the root causes of things like coronary artery disease when it affects the arteries of the heart, or things like strokes, which affect the arteries in your brain.
なんだここプラークだらけだどんどんひどくなってるね足元気をつけて一個一個運ぶしかないはいやっと抜けたそれにしても心臓へ血液を運ぶ冠動脈がこんな状態だなんてただ事じゃないな
Oh, it really is no joke. Like, that's a coronary artery? Like, that's pretty bad. So your coronary arteries are the arteries that supply blood to your heart. So yes, in a sense, your heart feeds itself, and it's actually the first organ that it feeds. The first blood vessels that come off the aorta are your coronary arteries, and if any of those are blocked, then you have a significant portion of your heart that won't get the blood it needs. As we learned earlier in the episode, the heart is basically one big muscle. And unfortunately, when those muscle cells die off from a lack of oxygen due to no blood flow, you're not really going to get them back too well. They can recover a little bit, but overall, once you've lost it, you've lost it. And once those heart muscles start to fail, you end up with a condition called heart failure. And if that sounds bad to you, then yes, it is indeed bad.
冠動脈心臓を取り巻いて存在し心筋に酸素及び栄養を送る動脈全身の血液量のおよそ 5% に相当する大量の血液がこの血管を流れる
I'm laughing only because this is actually a pretty decent map of your coronary arteries. So you have coronary arteries that supply both the right side and the left side of the heart. So on the right side, you have your lone right coronary artery, or what we call the RCA. So this goes down the right side of your heart and will wrap around to the back. Now on the left side, you actually have what we call a left main artery, and that further divides into two big arteries. So you have the left anterior descending that you see in the front, so that supplies blood to the anterior portion of the heart, anterior meaning the front. And then the other one is what we call your left circumflex artery, and that's because that one kind of goes off and wraps around the back of the heart on the left side. All of these vessels have like branches and things like that, like your diagonals, your obtuse marginals, your ramus, blah, 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 but we won't go into that. So long story short, you've got three major vessels. Two of them are branches of the left main artery. So depending on which blood vessel is blocked will have different effects on the heart because, like we said, the different portions of the heart do different things. So yeah, I'm sure we're gonna go into that a little bit forward from here, but yeah, I just wanted to kind of outline the coronary arteries a little bit.
冠動脈のプラーク崩落箇所どうなってる？
血小板により修復作業は進んでいるのですが、血管が狭くなった影響で血圧が上昇しています。
何？
狭心症の症状が出ていますね。ギリギリ赤血球たちは通れているようですが。
最悪の事態は免れたか。しかしまだまだ二次災害の危険は残っているということだな。
So now we are talking about the effects of a blocked coronary artery. And they mention here that there are showing signs of angina. So angina is basically chest pain or chest discomfort or a pressure, as some people describe it, that is caused by a blockage in one of your coronary arteries.
心筋梗塞。冠動脈に血栓が生じて心臓に血液が巡らなくなり、心筋が壊死してしまう疾患。胸部全面の激しい痛みが長時間持続し、呼吸困難、不整脈、チアノーゼ、ショック状態などを起こす。
このままでは酸素が届かなくなり、心臓が壊死してしまうぞ。
Alright, so he has officially defined heart attack, and what he is talking about here is actually just a myocardial infarction. I'm going to clarify things a little bit. So the words heart attack are super vague, and it's something that we as healthcare workers would never use between ourselves. We will use it in a sense towards our patients, but it's too vague to use between, say, like doctors and nurses and things like that. So a heart attack can mean one of two things. So the first one is the one that probably most people think of with a heart attack is like, you know, in the movies or whatever, when somebody like clutches their chest and like keels over and they're dead. So we would call that a cardiac arrest, where the heart stops and is no longer beating and the person dies and needs CPR in order to be resuscitated. The other meaning is a myocardial infarction, or an MI as we like to call it in the healthcare field because we shorten and abbreviate everything. So a myocardial infarction is where you have a blocked coronary artery, which means that a portion of your heart isn't getting any blood flow and therefore is not getting enough oxygen. As you can imagine, your heart muscle cells will start to die off and start to get damaged without any oxygen, and that causes symptoms like chest pain, shortness of breath, nausea, vomiting, sweating, and things like that, and just this feeling that things are not right. And this often causes people to go seek medical attention in a hospital. Now, what does get confusing is that a myocardial infarction can actually cause a cardiac arrest. This is especially true when you have your left anterior descending coronary artery affected and blocked off. That LAD coronary artery is actually called the widowmaker for this very reason. And yeah, it's not fun. So this chest pain will usually bring people to the hospital, or at least to their doctor's office, where they're going to get some tests done to see what kind of damage there is to the heart. We actually do have different ways to identify myocardial infarctions. One is through an ECG, and where you can see differences in the waveforms that are in there. Another thing that we do is we measure the troponin levels. So troponin is an enzyme that is released specifically by heart muscle when it's damaged. So if we see an elevation in your troponin levels, then that's pretty indicative of some sort of heart damage. I will also make just a slight correction here as well. So while the typical myocardial infarction symptoms is chest pain, usually what we call retrosternal or behind your sternum or sort of in the front of the chest, it is not necessarily that. So the classic sign is the chest pain radiating up to the jaw and or down the left arm. However, I have heard of so many variations of this, especially in women. So women actually tend to exhibit different MI symptoms than men. Not to say that men can't exhibit them either, but I've heard of everything from pain in the right arm. A very, very common one is like a heartburn feeling in sort of your epigastric area further a bit down from your sternum. I have also heard of like back pain is another common one, especially between the shoulder blades. I think women, some of them just will even have like lower back pain as their presenting symptom. And I have no way to confirm this, but I read a story on Reddit actually where somebody's presenting complaint was pinky finger pain, and it turns out they were actually having a myocardial infarction. You don't even necessarily have to have chest pain. Some people just show up with like shortness of breath. Some people just come up with like nausea and vomiting and sweating, and they just don't feel right. So yeah, there's a whole bunch of different symptoms, which sounds absolutely terrifying. And actually there is something that we call a silent heart attack, which is where you don't even have any symptoms at all. This is pretty typical in people with like uncontrolled diabetes because they have various types of neuropathies and things like that, where they just don't feel things as normally. And yeah, I did actually have a patient one time who was having a silent heart attack, and his only, and it's not even a symptom really, like the only reason why we caught it is because his heart rate was really elevated. So then we ended up doing some blood work and an ECG, and they were like, oh, sir, you're having a heart attack. And off to the cardiac unit he went. Yeah, so it's not always straightforward to diagnose a heart attack, but fortunately the tests that we use to determine if you've had a heart attack are pretty easy and very simple.
そんな無責任だ。働けと言ったり働くなと言ったり。動いてくれ心臓。僕はまだ。
Whew, this is intense. Like really, it's intense even for me. But this does actually have sort of an element to truth in how it's presented, because actually there is something that we in the medical field call the impending sense of doom. And when patients start to get like restless and they start to panic and they feel that something's like really wrong, but they can't verbalize exactly what or why, that is not good. They are telling you something and they are probably trying to die soon. And I'm not lying, it's actually a thing. So when you have a blocked coronary artery and there is enough damage to the heart where it's just not getting enough oxygen, like I said, in particular, that left anterior descending coronary artery is usually the culprit. Then you start getting what we call arrhythmias and a cardiac arrest, which is the other type of heart attack that we kind of talked about.
頑張ってください。頑張りやがれ。頑張れ。もう一度動けよ心臓。
All right, so that concludes our episode for this week, and it looks like the next episode is called Cardiac Arrest, which we are already starting to see revival and a change. So I can only hope that this person has sought medical attention and they're probably going to get resuscitated. But yeah, thank God for modern medicine, because back in the day, you just would kind of keel over and die from this. This is probably one of the more shocking things I learned a few years ago, but CPR as we know it wasn't really trained to the general public, or like the general public wasn't really aware of it until as late as the 1970s. So that's like really insane to me that, you know, people before that would just like keel over and die and like that was it. But yeah, like we've made so many medical advancements nowadays that the vast majority of people who come in with like a myocardial infarction into the hospital will survive. And I've met patients who have lived with coronary artery disease for like 20 plus years, which is absolutely insane. But yeah, I guess we will be covering that with the next video. So in any case, I hope you guys enjoyed this, and if you are wondering, I'm not wearing kimono today because I kind of injured my back last week and it was just like too painful to try to dress myself, so I'm just wearing this for now. And also, if you haven't noticed, there's like a whole bunch of boxes and stuff in the background, so like please just ignore the mess. As I mentioned in the last video, I'm actually going to be moving to a new apartment next month, so I've already started the process of like packing up all my stuff. So yeah, So yeah, hopefully everything turns out for the better with the next episode. And yeah, so I shall see you all next time. Bye!